In the United States, we use two concepts, one called race and the other called ethnicity. Race encompasses options like white, Black/African American, Asian, and others listed here on the screen. Ethnicity is the other concept, and you can see it encompasses options like Hispanic or Latino. Usually, when asked demographic questions, people are asked to provide an answer for both race and ethnicity. But in the future, these two concepts will be combined into one concept called race/ethnicity. Combining the two concepts of race and ethnicity into one category gives people more options to select from, which you can see on the screen. At Ann and Robert Lurie Children's Hospital, we have over 3 million patient records. Keep in mind that 13.3% of these records are labeled as Hispanic or Latino. In the future, patients and families visiting Lurie Children's will be asked the new combined question when filling out demographic forms. The question will be labeled as race/ethnicity, and patients can choose any of the options listed here on the screen. Any new or returning patients visiting will have their records updated to the new format, but there are about 2 million patient records that will never be updated because we won't see them again. Sometimes we don't see them because the patient has grown up, they are not sick anymore, maybe they moved away or are getting care somewhere else. Another reason is if they passed away. It's important for us to be able to update the older records so that they match the new records. At Lurie's, we do a ton of research using demographic data. The old records have 2 variables, but the new records will only have 1 variable. Our goal is to make our records consistent so that we have the most accurate data to support our research and clinical care. The question is, how do we update the older records to match the new format? We have 3 possible solutions. We will show you each option and then ask you which you think is best. Your opinion is important and will help us decide. In option 1, we look at the old records that will never be updated. First, we find records where ethnicity was selected as Hispanic or Latino. Then we look to see what was selected for race. If any of the race selections are marked white, black, or any of the selections shown here, then we will update this record to Hispanic or Latino. In option 1, we prioritize the Latino identity for all records. In option 2, we find old records where ethnicity was selected as Hispanic or Latino. If race was selected as white, then we will update this to Hispanic or Latino. But if any of the race selections were marked black or any of the choices shown here, then we will update this record to more than one race. In option 2, we prioritize the Latino identity for some records. In option 3, we find old records where ethnicity was selected as Hispanic or Latino. Then we look to see what was selected for race. If any of the race selections are marked white, black, or any of the choices shown here, then we will update this record to more than one race. In option 3, we prioritize the more than one race identity for all records. Let's look at a summary of the 3 possible solutions. Remember that the way we collect demographic data is changing. The problem is that there are old records that will never be able to be updated by the patient. This means we will have to manually update these old records to match the new format. In option 1, we update the old records, prioritizing the Hispanic or Latino identity. In option 2, we handle it in 2 different ways. If the old record has race selected as white, we will update it to Hispanic or Latino. But if the old record has race selected as something else, we will update it to more than one race. In option 3, we update the old records, prioritizing the more than one race choice. We recognize each option has its own benefits and challenges, and none are a perfect solution. We shared this information with you so that you can provide your feedback. We value your opinion, and it will help us make decisions in how we move forward. Please return to the survey and answer the questions. Remember, there is no right or wrong answer, just what you think is best. Thank you.